Welcome to NCLEX Crusade International. And today we will be talking about metabolic alkalosis. So if you are a nursing student in nursing school, if you are currently preparing for the NCLEX, this video is for you. I will be teaching you today some important concepts about metabolic alkalosis. What are the causes? What are the clinical manifestations of metabolic alkalosis? Also, what are the nursing interventions that you need to know? And of course, we will always have the opportunity to practice some questions together. And today, I want to do a little bit of a clinical scenario. So basically, the same patient with the same condition, how you can see different style of questions, from basic to more like intermediate to a prioritization style question. So do not move, do not go anywhere, because this will get very, very interesting. Welcome everyone that have joined today. My name is Professor Rainier Arado. I am a registered nurse here in the US. I've been a nurse for over 5 years, and I've also been teaching NCLEX preparation in our NCLEX Crusade Academy for over 5 years. So welcome to our channel and welcome to today's interaction. If you missed last week's topic, we talked about respiratory acidosis and respiratory alkalosis. If you have not seen that video yet, go ahead and find it in our YouTube channel, and you will be learning a lot from that video as well. And also make sure that you look for our 7-day training on the NCLEX preparation. What are the steps that you need to do to prepare for the NCLEX the right way? Coming very soon. I don't want to give an exact date, but I am working on my next 7-day training, and it will be about pharmacology. But I am not going to put an exact official date yet, because I have been working a lot in our membership that we will be launching soon. But let's talk about today's topic, metabolic alkalosis. Let's begin with the definition of metabolic alkalosis. The definition or description, it is a deficit of carbonic acid and a decrease in the hydrogen ion concentration that results from the accumulation of base or from a loss of acid. When you listen to this description, sometimes it's a little bit difficult to understand or grasp the concept. This is why I like to learn what is metabolic alkalosis by knowing some of the causes of metabolic alkalosis. In other words, what can cause a condition on the patient? What can develop into a metabolic alkalosis? Any dysfunction of metabolism that causes an increased amount in the available base solution in blood, or a decrease in the available acid or hydrogen ions. So if you think about some of the common causes of metabolic alkalosis, we have to think of conditions such as the use of diuretics, excessive vomiting or gastrointestinal suctioning, hyperaldosteronism, ingestion or infusion of excess sodium bicarbonate, and massive transfusion of whole blood. These are only some of the known causes of metabolic alkalosis. And like I described on our last YouTube live, what I don't want you to do is to only memorize the conditions that are known to cause metabolic alkalosis, but rather to really understand why the use of diuretics, why ingestion or infusion of excess sodium bicarbonate can turn into metabolic alkalosis. So let's look at the use of diuretics. So what is going on with the use of diuretics? If we understand the mechanism of action of a diuretic, we know that it's going to increase the urinary output. And of course, there are different diuretics that act differently on different parts of the urinary system. But because of the use of diuretics, there will be a loss of hydrogen ions and chloride because of the diuresis. And as a compensatory mechanism, there will be an increased amount of bicarbonate in the blood. So bicarbonate will be reabsorbed more. So we have two things going on with the use of diuretics that can lead the patient to develop metabolic alkalosis. One, the loss of hydrogen ions. You're losing acid. Anytime you lose acid from whatever means, there is the risk of developing alkalosis. And at the same time, as a compensatory mechanism, there will be an increase in the reabsorption of bicarbonate, which in turn could lead to metabolic alkalosis. If we look at option number 2, excessive vomiting or gastrointestinal suctioning, you have to think, well, what's going on? Why excessive vomiting can cause metabolic alkalosis? The reason is because you have to understand that in both excessive vomiting and gastrointestinal suctioning, there is a loss of hydrochloric acid. And if the patient is losing too much hydrochloric acid, that can take the patient to develop metabolic alkalosis. And so on. What I want you to do is, whatever book that you're using, that you're referencing to, I love the Saunders book, the Pearson's book, the Kaplan book. Try to find in your studies, when you are studying for metabolic alkalosis or metabolic acidosis or whatever condition that you are studying, try to determine why. You have to learn the whys of nursing. Rather than just memorizing, always ask this question: why? Yes, diuretic can develop metabolic alkalosis. Why? Oh, it's because of the loss of hydrogen. But why the loss of hydrogen can turn into metabolic alkalosis? Why, when there is reabsorption of bicarbonate, why can that develop into metabolic alkalosis? Because if you understand the whys, you will be able to answer NCLEX style questions much better. What are some clinical manifestations of metabolic alkalosis? At the neurological level, we can see lethargy, irritability, confusion, headaches. We can see at the cardiovascular level decrease in blood pressure, hypotension, dysrhythmias, tachycardia. Gastrointestinal, we can see nausea, vomiting, anorexia, and respiratory. We also have to watch for the respiratory rate as a compensatory mechanism. Okay? What are the nursing interventions, or some of the nursing interventions in a patient with metabolic alkalosis? We already talked about the clinical manifestations respiratory wise, so we definitely have to monitor for any signs of respiratory distress. We have to prepare to administer medications, intravenous fluids, and prescribe any medications prescribed to promote the excretion of bicarbonate. And of course, thinking of the dysrhythmias that could develop from the alkalosis. Remember the exchange between hydrogen ions and potassium, how we could need to administer or replace potassium medication. So if you don't remember exactly the reason why the patient with metabolic alkalosis might need potassium replacement, go back to the video that I did last week that explains that information very well. For the remainder of the YouTube live today, what I want to do is I want to practice some questions together. The first question is very basic. It's not too difficult, but I want you to start thinking. I want you to start using those 5 key factors of an NCLEX style question, and also try to develop that process of elimination. And we're going to be practicing this on this question and on the following question. So here is the first question that we will be discussing on this YouTube live. It says, the client is in the oliguric phase of acute renal failure. So what are some keywords that we need to identify in this scenario? We will identify the oliguric phase, 1, and also that the patient is in acute renal failure. So we know that something is going on. The patient is unable to have an adequate urinary output because the word oliguric describes that. And also understand that the patient kidney are not functioning very well. The patient is in acute renal failure. So something is going on that the patient's kidney are not functioning as they are supposed to. For which risk should the nurse assess the client? In other words, what conditions can develop from a patient who is in acute renal failure in the oliguric phase? Now you have pulmonary edema, metabolic alkalosis, hypotension, and hypokalemia. So let's discuss each one of these answers and let's see if we can eliminate some of these answers. For example, answer number 2 states metabolic alkalosis. So think about this. If the patient's kidneys are not working very well, the patient is unable to remove or excrete hydrogen ion in the urinary output. If the patient is retaining hydrogen ions, is the patient likely to develop alkalosis or acidosis? If you really understand what can cause acidosis or alkalosis, you will understand that answer number 2 can be eliminated, because we are not losing hydrogen ions in this scenario. We are retaining hydrogen ions because the patient is unable to excrete the hydrogen ions. Okay? And also think about that bicarbonate will be used to buffer or to compensate the levels of hydrogen in the blood. So now we are not only losing, we're not losing hydrogen ions, but now we have another problem that could be developing from this scenario. Not only the urinary system is being affected. Remember, if the kidneys stop working or they're not working as they are supposed to, we could have other system being complicated. So for now, answer number 2 does not make sense. Answer number 3, hypotension. Well, if the patient is on the oliguric phase of acute renal failure, the patient is at risk of fluid overload or fluid deficit. What is the patient at risk of? the patient is at risk of fluid volume overload, fluid retention. So hypotension does not make sense. Answer number 4, hypokalemia. Let's think about hypokalemia. If the patient's kidneys are not working, is the patient able to remove potassium via the urinary output? No. The patient can develop hyperkalemia because the kidneys lose the ability to excrete potassium. So the patient has a high risk of developing hyperkalemia, not hypokalemia. If not, think about the patients who are on end-stage renal failure. What are they in danger of developing? Hyperkalemia. So answer number 4 is eliminated. Answer number 1, pulmonary edema, that is the correct answer. And why? Well, we kind of talked about this. If the patient is on the oliguric phase of acute renal failure, there will be a decreased urinary output, there will be increased fluid retention, and if the fluid retention is too severe, then the patient can develop pulmonary edema. So this is the analysis that you need to have in this scenario. But like I stated, this is not a very difficult scenario. It's mainly a content style question, but you need to have the ability to apply some nursing concepts in order to get to the right answer here. Not only memorization. I think that if you're only using memorization here, you're probably gonna make a mistake, because you really have to understand what is going on each one of these scenarios in order to identify if it applies or if it can be caused by the oliguric phase of acute renal failure. So let's go to the next scenario. I did a YouTube live a few weeks ago on the tic-tac-toe method, which is an excellent strategy to interpret arterial blood gas. This question is about interpreting the ABG, the arterial blood gas. I will not go into details on this question here on how to use the tic-tac-toe to interpret the ABG, but it's very simple. Find the video in our channel that talks about the tic-tac-toe strategy. It says, Mr. Smith is a 45-year-old male, arrives in the emergency department, and an arterial blood gas is obtained, and the results are the following. The pH is 7.37. The PaCO2 is 55. Pressure of oxygen is 51. And the O2 saturation is 79. And bicarbonate is 38. In this scenario, we have a lot more information than what we need to interpret a basic arterial blood gas. Because to interpret a basic arterial blood gas, basically the only thing that you need is pH, CO2, and bicarbonate. You don't need the pressure of oxygen, and you don't need the saturation. To perform a basic in ABG interpretation, which is what you need for the NCLEX. Okay? So we know that normal pH is between 7.35 and 7.45. The pH in this scenario is 7.37, which is normal pH. The CO2 is 55. Normal CO2 levels are from 35 to 45. So 55 means that the CO2 levels are very high, is on the acidic range. And bicarbonate is at 38, is very high the bicarbonate, which is on the alkalotic or alkalosis stage. So we have the CO2 in acidosis, we have the bicarbonate in alkalosis, and we have the pH in the center. We have the pH that has been compensated. So we call these scenarios fully compensated. But we have to identify what is the bottom condition. We know that the pH, although it is normal, it is more inclined towards acidosis. And the lab value between CO2 and bicarbonate, the one that is on acidosis is the CO2. So what is this called? This is called fully compensated respiratory acidosis or respiratory acidosis fully compensated. If you find how to use the tic-tac-toe method, it is very simple to interpret this ABG. In this scenario, we do have a patient that has fully compensated with a respiratory acidosis, but we know that although it is fully compensated, the patient is in hypoxia indicated by the low O2 saturation level and hypoxia with the low pressure of oxygen that is 51, when we know that the normal levels of PaO2 is from 80 to 100. So this scenario here is, I would say, basic to intermediate. Why? You need to know how to interpret the lab values. You have to remember some of the lab values, what is normal, what is abnormal, what is low, what is high. So this is a content question, but a little bit higher thinking. Remember that on the NCLEX, you will find questions that are below the passing standard, near the passing standard, or above the passing standard. Let's look at the next scenario, and it is very similar to what we just discussed. They're giving you the same pH, same PaCO2, same PaO2, same bicarbonate. They are not giving us, in this scenario, the O2 saturation, but they are giving us the pressure of oxygen. And now this question says, well, based on this exhibit, based on these ABG results, what is the nurse priority action? But it's asking you to select several of the priority action. So this is a higher difficulty of questions, because not only you have to interpret the ABG, you have to understand what is going on, but based on the interpretation that you just completed, what are nursing actions that are appropriate? And the first answer that we have is administration of oxygen. We already interpreted this ABG and we identified it as a fully compensated respiratory acidosis. We know this already. Now, we know that the pressure of oxygen is very low, it's 51, and we know that the normal is from 80 to 100. So if the patient's pressure of oxygen is low, does answer number one, administration of oxygen, make sense? The answer is yes. But you have to be very careful, because I can turn this correct answer, administration of oxygen, I can quickly turn it into an incorrect answer. If I say administer oxygen 10 liters via nasal cannula, well, in that scenario, then the administration of oxygen would not be the correct answer, because the way it's being administered is incorrect. So do not be too quick in judging what is right or wrong, but rather really interpret what they are providing, the answer that they are providing. So answer number one makes total sense. Answer number 2, initiate a rapid response. Initiate the rapid response team. Activate the rapid response team. You have to think about what are the scenarios that a rapid response team can be activated. Well, if a patient is on a critical condition, there is an acute change in the patient's condition, it's definitely a criteria to activate the rapid response team. If we look at the scenario, the pressure of oxygen being 51 is sufficient evidence to activate the rapid response team because the patient is with respiratory compromise. And sometimes students struggle to determine when do I activate the rapid response team versus when do I call or activate the code blue. Remember that the difference is in order to activate the code blue, the patient needs to be in cardiac or respiratory arrest. So answer number 1, answer number 2, good answers. Answer number 3, inform the patient to cough and deep breathe. This is an answer that is a little bit tricky because they are not indicating on the stem of the question the patient's mental status, whether the patient can follow or not follow instructions. The mistake that I see students make all the time is to assume that because of a lab value, the patient should be behaving XYZ way. And sometimes nurses can say, well, if the PaO2 is 51, the patient is unresponsive and confused. We cannot make that mistake. There is no indication on the stem of the question that states that the patient has altered mental status or is unable to follow instructions. Asking the patient to cough and deep breathe, is it really going to fix the problem? No, but it does help. Remember that the patient is in acidosis, respiratory acidosis. So yes, it will help cope with the condition, but cannot be the only answer. That's where you have administration of oxygen, calling the rapid response team. So 3, it is an appropriate action because it helps with the condition. Now, if somehow on the statement, on the stem of the question, it would say that the patient is confused, that the patient is lethargic, unresponsive, then you can assume that the patient in that scenario will not be able to follow instructions, and therefore informing the patient to cough and deep breathe will not be the correct answer. As you can see, NCLEX Crusaders, analyzing an NCLEX question goes beyond just making a quick assumption based on knowledge. You really have to understand the scenario, and you really have to use that critical thinking. Otherwise, you make a lot of mistakes. Answer number 4 says, begin IV normal saline at 100 mL per hour. There's not really an indication to administer fluids in this scenario. I can eliminate answer number 4. And answer number 5, arrange a transfer to the intensive care unit. If you look at answer number 5 and you compare it with answer number 2, in answer number 2, you're talking about bringing the rapid response team. I'll drink some water. In answer number 2, you're thinking of activating the rapid response team and initiating the rapid response team. So the focus right now is patient care, specific patient care. It says, what is the priority nursing action at this time? This is an important keyword or important keywords. Transferring the patient to ICU is something that we will be doing later on. It's not the priority action now. The focus, it is to treat the patient's condition at this moment. So answer number 5 can be eliminated. Why? It's not the priority at this time. Is it something that we could do later on? Absolutely. The patient will most likely be transferred to the ICU, but it's not the priority. Okay, let's do one more question. Let's practice one more question together. For all the new members of this YouTube Live, if you're here for the first time, remember to subscribe to our YouTube channel. Find that subscription button, subscribe to the channel, and make sure you activate the bell so you get all the notifications once we're live. And also, please help me by liking this video and share this video with other nurses out there. So let's do one more question. I'll give you some time to read it and identify. How do you activate the rapid response team, Professor? Basically, you call a number. You ask a nurse to call a number. Depending on the hospital, the number could vary. You might have to call the operator, but there is a protocol and procedure to activate the rapid response team. To activate the code blue, there is a button that you press to activate the code blue, and of course, you can always request somebody to call the operator. All right, so this last question states, Mr. Smith, so we continue with Mr. Smith, lab values now includes a serum potassium level of 2.8. What is the priority nursing action at this time? So as you can see in this scenario, they're giving you a lab value. You have to use content to identify if this is normal or not. So you have to identify the normal lab value for potassium. And if you don't remember, it is from 3.5 to 5.0 in most books. So a potassium level of 2.8 indicates that the patient has low potassium, or the medical term will be hypokalemia. That is perfect. Good job. But now, what is the priority nursing action? What will be the most important priority action with a patient that has hypokalemia? So I need to find an answer that helps the patient's condition. Answer number 1 says, teach the patient about potassium-rich foods. If you look at answer number 1, can potassium-rich food help with potassium levels? Yes, but we're dealing with an acute condition. Basic teaching about eating foods with potassium is more pertinent for discharge teaching rather than to deal with this acute condition. Teaching the patient about potassium will not help increase the potassium levels right now. This patient needs medication. So answer number 1 really delays patient care. Answer number 2, provide the patient with oxygen at 2 liters per nasal cannula. The only thing that we have in this scenario is a low potassium level. Is there any description that states that the patient is now having a respiratory problem? Remember that we have to use what we see in the scenario. So providing oxygen at 2 liters, is that going to fix a potassium level of 2.8? Not at all. So this answer, although it is oxygen, it does not make sense. So do not fall into that mistake that anytime you see oxygen, you think that that will be the answer. It depends on the scenario. So administration of oxygen does not help with the patient's condition, therefore, it will not be the priority nursing action. Answer number 3, contact and notify the healthcare provider immediately. If you look at answer number 3, you have to think, and this is a strategy that you can use. It's very effective. Whenever you see an answer that states, call the doctor, you need to ask this. Do I have an answer that I can do, is within my scope of practice, and will help with the patient's condition? Is there an answer? So far, 1, I can do, but it does not help to replace the potassium. Gone. Answer number 2, I can do it, but it does not help with the patient's condition. Gone. Answer number 4, initiate normal saline at 20 ml per hour. Is that going to help to replace the potassium level? Is that going to help with potassium? No. Therefore, this answer does not make sense because it does not help with the patient's condition. So the correct answer is answer number 3. But they can give you a very similar scenario, but then one of the answers is something that you can do and helps. Like, for example, if one of the answers stated, replace the potassium, administer potassium, then that will be the answer. It will not be to call the doctor and notify the doctor. Remember, although in this scenario calling the doctor made sense, do not assume that calling the doctor is always the answer. Remember, for the NCLEX world, you have orders that you can follow that are available without calling the doctor. Because if this rule was not on the NCLEX, then all the answer would be call the doctor and let the doctor make the decision. There are some things that you can do. The only thing that you have to determine is, if I do this action, does it help with my patient's condition? If you have an action that helps with the patient's condition, do it. Do not think, oh, let me call the doctor first to tell me if it's okay to do this action that I have on one of the answers. So it is very important that you understand this concept. Okay? All right, family. That is it for today. Thank you for following NCLEX Crusade International. Remember, subscribe to our channel, like this video, and share it with other nursing students. God bless you all. Bye-bye.